Yeah. So we switched the language now.
All right.
But so I think we have a very interesting book that I looked like from the transcript to this point, because together we share. We have been talking about psychology as it is defined in academia and in various disorders, but we've also been talking about a different psychology, the psychology of everyday life.
That's right.
And that doesn't get addressed a lot. A sort of, I don't know if common sense, it's not exactly common sense, it is a logical sense, I think. I think it's a very absent thing.
Everything is changeable, including what's common sense and what's common knowledge and so on.
Fair enough. I believe it's a rarity, though. The way I conceptualize it, I'm sure it will change over time, but the way I conceptualize it is we talk often about how to think better or about how to avoid unnecessary stupidity.
Yes, when you notice that the first interest in psychology was about the question whether people have souls or are they mere automata. This is how Descartes raised this question.
And he would be maybe the first psychologist.
Certainly, let's say, at least the first modern psychologist.
Yeah.
But it's interesting that the first interest in the soul was metaphysical.
Rather practical?
Rather than practical, of course. Mainly the question is not so much whether we have souls, but whether our souls are immortal. Indeed, most people who thought we are not immortal thought we had no soul. And the reason is metaphysical. There's a theory of substance which says only real things are immortal. Things that are transient are not real, which is very funny because we all know the difference between mirage and appearances. But philosophy took all appearances to be mirage as opposed to substances that are eternal.
I'm sorry, is it possible to turn off the radio?
It's the television, actually, but yes.
Please.
Yes, I want to. Why should I? It's all right. Here we are. Let's start all over again then.
No, it's okay. It's I think it's fine. I just didn't want it to
it your way.
Mess up the transcript.
Fine.
So would you say that like this fixation on the metaphysical question would have been an error in thought?
No, I think all Western thinking, as opposed to all other, since antiquity till 1905, centered on the difference between substance and appearance.
Substance and appearance, okay. The thing I mentioned error in thought because it was connecting to my notes from other times that we talked, like people make errors in thought all the time. It is unavoidable.
Unavoidable.
And yet
this is called
this
is called fallibilism.
Yeah.
Fallibilism became very fashionable.
And yet some errors not only are avoided, but should be avoided. They are,
There's no question about it.
and
You see,
yes,
all killing is much to be avoided and is punishable when it's avoidable, but when not when not. And unavoidable killing is a mistake that is not stupid.
why is it a mistake, unavoidable?
Because killing which is not a mistake is a different category by law. Killing with intention is called murder.
Oh, okay, I understand. Understand now what you mean. I was thinking about more lower stakes. I was thinking, I had the quote that you said, you talk to physicists and you say, of course, Newton's theories were false. And they tell you, why do you hate Newton?
That's correct.
And this is an interesting conflation of hatred and criticism.
Moreover, it's the question, is a false theory a mistake? In a sense, of course it is, because he wanted his theory to be true. He thought his theory was true. Einstein did not think his theory was true, and he tried to refute it. He did not succeed, but he tried to refute his own theory, whereas Newton was convinced that his theory is true.
Yeah. I was thinking more about the errors of the people. I was thinking not only is it seems like, well, people obviously make the mistake that a criticism is a bad thing. That's one of the big errors of thinking.
There's no question about it. There's no question about it.
But then I think another problem might be that people criticize with error, with hate in their heart. Like they think the criticism should be an insult.
Besides, you dare criticize me. Who do you think I am?
Yeah. So it goes.
That's a German professor speaking, of course.
Yeah. Who do I think I am, or who do you think you are? It's two.
These are two different challenges. Yes.
Yeah. I think one of the the desire to be mistaken, the desire to find out where you are wrong is very, very rare these days. And it's kind of one of the themes is how to make, in my mind, how to make yourself smarter. Because
that's right.
With the same cognitive capacities, you can be smarter and dumber. It's just about the decisions you make.
Indeed, skeptic Robert Boyle said, trial and error is a respectable method, and it is a method of making mistakes on purpose, not because you want to make a mistake, but as a search for the truth. And I should say, when you hesitate, there is nothing to correct. When you make a wrong decision, you can correct it.
Yeah.
So wrong decision is better than hesitation. Of course, unless the wrong decision is too expensive, but that's another matter.
Yeah, unless the wrong decision was about jumping to the parachute or something of the sort. We talked about how getting offended was a waste of time, which is an interesting point, I think, especially in this day and age. You agree with the basic statement, right?
Not only that, I often said to students in an interview or in conversation, you are insulting. And the student would say, I'm sorry if you are insulted. And I said, you are insulting again. I'm not insulted. So he says, how do you think we're insulting if you are not insulted? And I said, how about trying to kill me and not killing me? Just a minute. Agassi.
No problem. So you tell your students, if you try to kill me and you don't,
it's still murder.
What
attempted murder.
What are you trying to teach your students? This is kind of confusing to me. What you just said. You say, you tell them you are insulting, but when they apologize, you say you.
No, when they apologize, they apologize conditionally.
Okay, okay. You're refining their intention and helping them see. I understand this now. And yet forgoing insults is very difficult. Like to us, it's overcoming education, isn't it?
You will not feel insulted once you feel very superior to the person who tries to insult you. Goes without saying.
But is that the only way to not be insulted?
No, there are other ways.
But
self-righteousness, for example, is the most common way.
Well, that's okay. Is it, I would have thought the best way would be some sort of a separation from a value system or separation from good and bad.
No disengagement, just keep the distance. See, there's here some very interesting paradox. If you want to conduct a fruitful conversation, you have to be both involved and disengaged at the same time. There's a kind of schizophrenia.
Yeah, that's very.
Which I like very much. People are afraid of schizophrenia, not realizing that schizophrenia is not the trouble. The trouble is loss of control.
That is that is one of the points I wanted to get to. But loss of control seems quintessential to
the disease.
To the disease, but to the condition too.
No, you can be schizophrenic and not ill. By the way, it's a very well known because there is an ambulatory paranoia.
Yes.
Ambulatory means not considered sick.
So in this situation, when we're talking about recommending schizophrenia, we're not talking about recommending delusions or hallucinations.
Decidedly not. Decidedly not.
Talking about a personality switch.
Exactly so. I'm all against taking drugs to enhance whatever it is. Yes.
Well, you can have hallucinations without drugs. You can.
Oh, of course. It is no doubt the case.
Yes. Yeah, so the if I want two personalities, how would I ever be able to control it? Because if one personality
It's a wonderful question. This is just the right question. If I knew the answer, I would tell you.
Okay, so you recommend experimenting, but but actually knowing how to control it is an art that everyone must find for themselves.
No, whenever you feel dangerous, whatever reason it may be, you can always stop. If you can't stop, then you're obsessive. You lost control.
When you yourself are feeling dangerous to people?
When you feel that whatever goes in your mind is dangerous, and never mind why, stop it.
Yeah.
I remember once I was in a conference that was opened by a very pompous speech. And I was very tired and I felt unwell for personal reasons that my situation was not good. And I felt really being pulled down. And I sat with a Jesuit friend of mine. And I said to him, I'm sinking, please help me. And he did at once. The Jesuits are very good at this because they waste half an hour every day thinking about hell. That's the training, that's the requirement. So they are in extremely good control. And by the way, when a Jesuit breaks down, it's always complete collapse, complete. Because they are so much in control, I mean.
How did he help you?
Oh, just talking to me.
Just talking to you.
Okay. Showing understanding of my condition, which was not easy. This is a kind of condition that most people don't recognize and don't know how to react to. but in you at once.
There is something that in Hebrew modern hippies, they call it leachil, containing.
Yes,
Or in some shamanic people, they call it holding space.
that's correct.
And
You got it twice right.
I have a third time too.
Good.
Is in psychodynamic psychology, they call it the here and now, folk being present in the here and now.
Yes, but I don't like the here and now.
Why not?
Because it's too rigid. There are other ways of doing it. I'm not opposed to here and now as such, but to the idea of here and now, I don't. There's a certain realist position that dismisses everyone who is not as realist as I am, as I am. I don't like that.
Yeah, the interesting. I'm not sure what to think about that.
I think some people have the need from time to time to thump the chest and yell.
Of course, we are apes after all.
We are apes after all, yes. I must say I'm not attracted to this position.
I think I have had as clinical supervisor, I had once a person who was very much here and now, and he was the most gentle person I ever talked to. And he was there was a magic that occurred when talking to him, because he focused on nothing other than what was happening immediately. And
But
that
quite possible he was a charismatic person, regardless of what he thought.
it wasn't so much the charisma, it was really a sensitivity. But
I accept it.
that is quite
sensitivity is really very good as long as it doesn't hurt you.
Yeah, quite possible he was an extraordinarily therapeutic personality, regardless of.
Yeah, quite.
To circle back to one other point about schizophrenia, so like a schizoid is a person who is born with maybe a little different wiring in an interpersonal way.
I think we are all schizoid. I think even dogs are schizoid. Cats are not.
Please explain.
And you can see a dog in two minds. Jack London describes a marvelous situation of a dog having two masters, was lost to one and so on. And these two masters decided to let the dog decide. And they said, we have to be fair, not to look back. And they went their separate ways. And Jack London says the dog ran to and fro, and had to decide finally. This cannot occur to a cat.
Yes, because cats are psychopaths.
I don't know. I like the cat's ability to relax.
For sure.
After a fight, a dog moves around to waste excess energy, not a cat.
That's true. A cat is very economical.
That's right.
So you would put schizoid as being, that would be your off-the-cuff definition of being of two minds.
Yes.
I always thought about it as a profound detachment from reality, from others.
I must add, it's not just being in two minds, which we all are now and then, but in a manner that is obsessive. That has to be done. If it's not obsession, and it's not psychopathological.
For sure, if it doesn't perseverate.
Yeah.
I do think to me, there's more to it than being of two minds, but we don't have to belabor this point. Okay, let's see. So I wanted to mention something about the modern way of thinking that goes against what we're talking about with offense. Is today the idea that we should be ashamed is very common, that to tell other people to be ashamed. And it's
shaming is the most primitive mode of punishment.
the most what mode of punishment?
Primitive,
Primitive.
ancient.
I would have thought stoning was up there.
Oh, yes, yes, no question about it.
I guess that's shaming too, in a way, in a much more painful way. But the crazy thing today is that people are thinking this is progress, because they're thinking that because they're shaming people for shaming people. They are shaming against racism, against homophobia, against transphobia, patriarchy.
The most famous case of shaming in modern history was of Robert Oppenheimer. He was a nuclear physicist who helped in making the bomb, and he was asked to make the hydrogen bomb and refused because the war was over. So they tried to bring him back by shaming, and they failed because after the shaming was finished, he got the best job in the world to direct the Institute for Advanced Studies in Princeton.
To me, it's an interesting thing that is happening in the world, where there's a lot of racism and a lot of prejudice, but the way it is being fought increases the intolerance.
And the Me Too movement is of shaming, yes.
Yeah, that's one aspect of it, but really just focusing on language, and it's almost like people are practicing offense, being offended, as a mode of self-emancipation.
Yes, or on the contrary, as staying put.
Well, they're staying put, but they think they are emancipating, and that's the poisonous thing, I think.
Point well taken. Thank you. Yes.
Okay, I wasn't trying to make. I don't know what's going to happen after I see them. I'm not after I say the things. I just wonder if you have things to add, and then we move on to the next topic.
You are the boss.
Apparently, and thank you very much for allowing me to be the boss of this. Okay, so the psychologist who makes their patient worse for their own good. That's one thing we talked about also. And how does a psychologist make their clients worse? What is the technique? I was trying to think.
Shaming.
Does the shaming come in the form of a question? Because obviously a therapist wouldn't say, you should be ashamed.
You see, assertions may meet with objection. When you mask the assertion as a question, and it's very bad. And of course, the paradigm case is, have you stopped beating your wife? And of course, the answer is always no. People hesitate saying no because it gives a wrong impression. But that's their mistake. When you are asked, have you stopped beating your wife? You should say no. If they ask why, you can say, I never started. And if you don't ask why, then that's their business. In court, if the attorney for the other side asks you, have you stopped beating your wife? It's your attorney who has to come and say why.
Why you ask this question?
No, why do you answer negatively? Why do you say you haven't stopped beating your wife? And you say, because I have never started.
Ah, okay. Yeah, Yeah. The psychologist keeps you worse by questioning in an evaluative manner.
Yes, when you are questioned in court, people take for granted the aggressive nature of it, and therefore you have two attorneys, pro and con. In psychology, the psychotherapist is supposed to be on your side,
Yeah.
and so there is no defense against him, which is what Thomas Sass complained about. Said if the psychotherapist happens to be against you, you are defenseless. See, usually people have all sorts of defenses against aggression, but there are cases that are hopeless. A complaint of a prisoner against the jailer is hopeless. The complaint of a doctoral student against his professor is hopeless.
Yes.
And the complaint of the I said that already, yes.
Of the patient against the psychologist.
Yeah, you see, it's a very funny thing that when a teacher sends a pupil to the headmaster, everybody knows who is in the wrong.
Mm-hmm.
What I've just said is against common sense, against the law, against humanism, and it's taken for granted.
Yeah, it's a bloody mess.
It is a bloody mess. Yes, you're right.
Why is it that the psychologist makes worse the client? Do they?
First of all, he may be a misanthrope. Secondly, he may feel misanthropic just today because his wife shouted at him yesterday. Or he may be careless for a moment. We are all human.
We are all human. We are all human, unfortunately.
So, because we are all human, we need defenses. And as I say, the patient has no defense.
Yeah, I wonder sometimes if it's because what therapy is economically, and it's true, it's the same for how medicine is structured. It's if you have 100% cure, your job is the person remaining sick, especially for.
Bernard Shaw wrote in 1904 his Doctor's Dilemma, and he said it's the interest of the doctor to have all his patients stay between life and death.
I'm not sure I fully understand.
The doctor is best off when everybody needs them.
Yeah.
And when everybody is well, then the doctor has nothing to do. This is why in welfare countries, doctors are paid regardless.
Yeah. This is again one of those errors of thinking that is just inconvenient, so people don't look at it and get to perpetuate some things.
Very possible. In England, judges are paid extremely well so that they won't need the bribe, that they won't be attracted or tempted by bribes. And then Shaw said, if you pay so much a judge, how can you expect them to be good judges?
Why would they be bad judges?
Because they will be disconnected with everyday life of human people, of human beings with ordinary problems.
Okay. Very hard to avoid. Very hard.
Very hard one. You see, it's one way or another. You're damned if you do, and you're damned if you don't.
That is always the truth. Yes, indeed.
By the way, is what creates schizophrenia.
That pressure of no good option.
The pressure, whatever you decide to be against you. Okay? Yes.
It is interesting, but associationally about schizophrenia in CBT, in cognitive behavioral therapy, they tell you to ignore your hallucinations.
There's no question that we all hallucinate. There's no question that most of us forget their hallucinations because they are terrified.
Yeah, and is that the healthiest thing to do you think?
No, the healthiest thing, do not mind your hallucination as long as you are in control. Again, I'm saying the same thing repeatedly.
Yeah, so it's a subtle but important difference between ignoring and not minding.
That's right.
Because ignoring is forced.
Ignoring may be dangerous. Not minding has to be more aware.
Mm-hmm. Yeah.
When the not minding is aware, it means that you can mind anytime.
And that therein lies the control.
Exactly so.
Okay.
You're quite right.
Am I exhausting you? Do you have energy to go on? Because I have more.
When I look exhausted, really.
You do not. You do not. That was my own self-consciousness. Okay. On the other end of offense and shaming is the topic of encouragement that we talked about, and how
That's correct.
it really is one of the most important things to do, even just in a conversation when you're talking with someone.
Just a kind word is at times extremely important.
And I wonder, looking at it from a self-help perspective, how can one encourage themselves while avoiding a problem of toxic positivity, of neurosis?
I don't know, but I know that I had extremely bad times, and I know that I went through them only because I knew that better times will come.
You had faith.
It's not faith, it was conviction.
Hmm. How is that different? Is conviction based on logic?
I don't know. The difference between faith and conviction is well known even to religious teachers.
Okay.
Conviction is unproblematic. Faith is overcoming doubt.
Okay. That makes sense.
Thank you.
One moment.
Take your time.
We briefly mentioned panic. Or we said, like before, the greatest enemy of therapy is panic.
Oh, I said panic is the last resort.
The last resort of the mind?
Of the stubborn.
And then after panic comes the euphoria, and that is the final escape.
If there is, I don't know, but it's an escape, certainly.
How can one use, what should one do thinking about one's healing? How should one reflect on one's own panic during the panic, in your opinion?
Not resist it. That's the most important advice. Don't resist it. It's only boomerangs.
Just let it flow its course.
Sure.
Yeah, that is one of the things I think are good in CBT, that they treat you, they get you to create those, to hyperventilate or to make yourself dizzy, so that you are becoming familiar with the physical feelings.
They teach you self-trust in many technical ways.
Yeah. They don't phrase it as self-trust, but that is true. They teach you that it's just shape, it's just waves upon the water. It's
That's right.
transient. I think, yeah, I think being your own therapy patient or being your own parent is sort of an important skill. And that's another one of the things that.
You see, since all my life I'm in the academic system, I usually have one very important piece of advice, not outside the academic, but in the academic. Don't read.
Yeah, don't read.
Don't go to lectures. Learn to stay in bed as long as you want. And people often told me, you are condemning me to staying in bed 24 hours a day. And I said, just try it. It's extremely difficult.
So you said you tell someone not to read and not to go to lectures to free them from their own forcefulness, aggression towards forcing them to do that?
To get freed of pressure. And pressure is always cooperative. I have to say this, which is too obvious, but in this conversation, I have to say it. Pressure is always two-sided.
Yeah. I read this funny quote once. It said, only nobody can make you feel inferior without your consent, but sometimes you'd be a fool not to give that consent.
Oh, yes, that is correct. This is the very famous book, Games People Play, which is very humble and very useful.
And it is inevitable to stop playing games, isn't it?
It is inevitable, yes. We all play all the time, yes.
I think it's just maybe a way of maybe the heart of self-betterment is awareness of the games and maybe switching a game when.
Exactly so, exactly so.
And
of course, it also requires learning. Bertrand Russell said he could not play and it was a defect in him. Of course, he played with ideas, but that's a different matter.
What he meant? He couldn't play what? He couldn't play games? He couldn't?
Games, card games, football, and so on.
Okay. Oh, he did a lot of play. He certainly played with words and minds quite a lot.
That's correct. That's correct. But he still felt it a defect in him that he was given highly Puritan education. He was, by the way, suicidal.
Was he? I didn't.
At age 16, yes, he wanted to kill himself.
At 16, it makes sense. He sounds very self-actualized further on.
Yeah, yeah.
One of the games that astounds me every time in how much it works and how much other people respond to it is the I am not impressed. The person whose game is being not impressed with whatever.
It's a dirty game. I remember once in an examination, one of the examiner said, I'm not convinced, try to convince me. And I said, don't answer him.
That's wonderful.
I lost points, but at least I saved him.
You were part of the examining
board, yes.
Board.
We are 3 examiners and 1 examinee. It's also just hair-raising.
I was terrorized by my advisor terrorized me with I'm not convinced for years. It didn't end until I left him. It was horrible.
Yeah, and my advice to you was leave him a day earlier, yes.
He was what a day earlier?
My advice to you was leave him earlier.
Yes, it was difficult to
yeah, to disengage.
To disengage, for sure. Okay, we talked about psychopathology and about, well, Freud said there's no sense treating in symptoms, and we both agreed, I think, that you must look at the symptoms.
When you speak about, for instance, sunstroke or typhoid, you only have to handle the symptom, not the disease. The disease goes away. The symptoms kill you.
The symptoms kill you. Yeah. And it's the idea that whatever you have to state what is the difficulty in psychology, and that they do that, but they do that through the symptoms, and they don't, they make the disorder something greater than the difficulty.
There are all sorts of options. You have to keep an open mind. On this, I think we agree.
Okay. And the last thing, the last constellation of things is our favorite, or my favorite topic of addictions. And some points I wanted to sharpen. We talked about understanding the role addiction plays in one's life, and then trying to replace that with something else. And that kind of being the hope for someone to progress.
The main point I make about addiction is that addiction is an obsession, and that the addict seeks an object of addiction. That is to say people are addicted to drugs. That is just not true.
There are
some people who are addicted to food, for example. There are people who are addicted to adrenaline, which they don't need any injections for.
Yes.
You can always generate your own adrenaline.
For sure. Yeah, you said the control is the addiction last time, and I like this quote that you said, the control is the addiction. It's the thing that people accuse the substance of doing, that really is the addiction. So the addiction is to ruin your life, or beat your wife, or be frivolous with money.
Yeah, I remember when I was young, somebody said to me, you don't understand, you have a bottle of beer and you have an excuse for breaking furniture. I thought this is just right.
Yes, because you can break furniture without needing
the bottle, yes.
Without the bottle of beer. But
I had a friend who said that it's no fun drinking with me because I'm always ahead of him.
Ahead of him in what? In
drinking. I hardly drank, and he drank stupid, but I was always ahead of him.
I don't understand.
The alcohol gives you liberty, which you can take.
Ah, okay. You were ahead of him in liberties taken.
Quite so.
Okay. But there is something in, if you take opiates, you have enough dose, you are in a position where you cannot care. Or just your relaxation, you have a strong chemical relaxation.
You don't suffer pain. That is, that you sense pain, but don't suffer it.
Yes.
That's an interesting fact.
Yeah, that it is one of the complexities of the analgesic
of the opium, yes.
The opiates.
And of course, we create our own opiates. That's why many people run.
Oh yes, I met a famous addiction researcher who was an absolute junkie for running. It was amazing because he was an expert on addiction, but he had no idea that he was a junkie.
Addicted, yes.
You know,
oh yes.
Not just addicted, but like he couldn't talk about anything else. He was like,
oh yes, yes.
But if I think about not just like if you combine alcohol with benzodiazepine, relaxation medication, they both act on the same neurotransmitters, creating a very, very powerful chemically synergistic effect.
It's always reuptake suppression, yes.
This one isn't reuptake suppression. This is agonizing of GABA. Well, I guess I don't think this is just direct agonizing, but the thing is that it presses the off switch of the body, of the brain, the central nervous system. and that is another liberation from pain. It's not exactly analgesic, but people get addicted to this complete turning off. And I don't know if this is the same as people getting addicted to the lack of control.
I think all addiction is addiction to lack of control, or hatred of responsibility, which is the same.
Yes, and you said another thing we said last time is it's better to be hostile towards yourself than to have ill intentions towards yourself than to fight yourself.
Yeah, but you see, the paradigm is men who need to drink in order to beat up their wives.
Yeah.
I think this is disgusting, of course, but it is unfortunately not unknown.
I had it was a very tragic case that I had as a psychologist, that I had a man who was insistent that it's not that he wants to beat his wife, it's the alcohol.
Exactly so, exactly. That's what I'm talking about. This is the role of alcohol.
Okay.
To take the blame.
Yeah. But then there is something, so it was interesting to me. You said that an addict, a gambler who understands his intentions, as you said something like this, a gambler who understands what he's doing, who accepts what he's doing.
I said in Vegas, there is a big notice, decide in advance how much you are allowing yourself to lose.
Yeah, but I forget how you said it, but I thought you said the implication of what you had said to me was, the way I thought about it was that a gambler goes to lose, destroys himself.
That's right. Or at least he transfers the decision to Mother Nature or to the wheel or whatever.
Yeah.
And by the way, most attempted suicides are like that, are gamblers. There is seldom that people commit suicide willingly, like King Saul falling on his sword. That was genuine suicide, clean and clear and so on. But usually people don't fall on the swords. For instance, when they take sleeping pills, they take 2 sleeping pills, wait 2 minutes and take another 2. And then there is the gamble, will I fall asleep before I kill myself or not?
Yes, yes.
This is the standard, what I'm saying.
It is, and what some video evidence has shown is that people actually need to practice suicide, and you see, like, a first jump is hesitant, and then
also they phone their friends to say, I'm going to commit suicide.
But then when they get practice, they don't. They go up like an Olympic diver and they just do their job.
Oh yes. The question is how sincere you are.
Yeah, it's a confused occasion. Going back to the gambler is confused as well, because no gambler would admit that they want to lose.
Oh, some do. Some people say, I'm going to kill myself, but let me give Mother Nature the last chance to save me. This is rare, but not unthinkable.
Okay. It was interesting. One of the greatest comics in the world passed away from leukemia, from blood cancer, a few months ago. And this man was so kind, and so his name was Norm Macdonald. He was so kind. He was so unusual in the business, and he was known as a gambler. He was known as a degenerate gambler. He came from a family that was so poor they couldn't eat, and then when he had money, he was a degenerate gambler. And 11 years ago, it stopped. 11 years ago, the rumors stopped. And I always wondered what had happened. And then you find out he had cancer for 11 years and he just didn't tell anybody. He couldn't cure himself. He couldn't stop until he knew that life was ending. which
Very
was
interesting. Thank you.
interesting for me because he was perhaps less relevant because you don't know the persona, but interesting for me that one of the smartest people I could think of was just making this error. There was a quote, "My cousin is an addict and look how much he suffers." And that appears as an argument against an investigation. Whereas if something is surprising, that should be an argument for investigation.
Of course.
Like, there's an issue with addiction and an issue running through everything we're saying, that the truth is intolerable.
That's right. I would say quite generally, the only argument against research, which is not dangerous, is that there may be a better, more interesting research. That's all. There's no other objection to research.
So when we say my cousin is an addict and look how much he suffers, what is being closed down? What avenues of thought are being shut down?
Oh, thinking of possible options.
Why?
It's always there.
Like, why does he suffer, or
how can you stop the suffering, if at all?
Mm-hmm.
There may be no way, but you should not exclude it a priori.
Yeah, you should not look at it as just a phenomenon that is
Exactly so.
a terrible earthquake.
Yeah, quite.
The last point is we're talking about the gambler that the gambler that accepts he has bad intentions is closer to getting out of it than one that does not.
Yes.
And it's that biggest question of how does one quit that we've talked about many times is last time we said, or one of the last times we said, that to quit, you need not only to decide, you need to have enough autonomy to be able to decide.
Yes, but mainly you should not tempt yourself as a self-test. This is the standard mistake of most people who get half cured.
They see if they can. So they're like, I've been good for 3 months. Let me just see if
I'm going to enter a bar and show you that I won't drink. The answer is don't enter a bar.
Is it not drink, or is it drink just one and get away with it? Because you have that.
It's the same. You are quite right. It's the same. There's no difference. By the way, you enter a bar in order not to drink, and then you say, oh, just one drink.
Yeah. Or you don't notice. They just put the gin and tonic next.
That's also a possibility. Jack London complained bitterly that this is so that drunkards make other people drunk.
Yeah.
You know, he was a drunk, Jack London. And he wrote a very interesting autobiographic essay called John Barleycorn about his own drunkenness.
What was interesting about it?
He ended by saying that he hopes that there will be a law against drinking because that may reduce the number of people addicted to drink. And of course, the historical fact went the other way.
Yeah. They banned alcohol, and then when that didn't work, they moved to something else.
Yeah, but not only it didn't work, it boomeranged.
Me being a conspiracy theorist, I feel like maybe that wasn't so unintentional. It worked great.
Well, that's the point about the conspiracy theory. You can't test it. When you can test it, it's no longer the conspiracy theory, but the theory about a certain conspiracy. Okay.
I feel like it helped to further destabilize the world down the line.
There's no question when you realize that before 1900 there was no law against any drug. So when alcohol became legal, they looked for something else, and then they found marijuana. Yes.
And then giant cartels took over nations all over the South America and destabilized those.
There's no doubt that nicotine is worse than marijuana.
I would say it's so hard to say that one is worse than the other because there's so.
Oh yes, nicotine is harmful.
Well, marijuana can.
Nicotine destroys your lungs. It calcifies your lungs. If you smoke long enough, you die of suffocation.
Things get complicated because you said nicotine, and there is other ways to consume nicotine than in smoking.
Oh, you're absolutely right.
And the cigarette and the marijuana can make one go insane eventually. It can develop such a tendency.
Yeah, you're quite right.
The comment that I was starting to quote was how we were talking about how to quit, you need not only to decide to quit, you need to have enough autonomy to be able to decide to quit.
Yes.
I think it's a fascinating concept of how can one move towards that autonomy. For me, it took 5 years to be able to quit marijuana.
Oh, interesting. See, in my childhood, marijuana was the drug of the poorest of the poor. And so it surprised me when I found it on campus.
Yeah, it's things change with status.
Exactly so.
Okay.
Also cannabis was supposed to make you aggressive, and then it made you a flower boy.
Well, that was the amazing thing about making it illegal in the 1930s and the Harrison Act is that it was inflamed by tabloid fictitious articles about the violence caused by marijuana.
About running amok, yes.
Yeah, running amok, exactly.
That's correct. I remember that. I was there, yes.
You were there. That's amazing.
Sure.
It had, and that's just not true. It's not even a little true. It didn't happen.
Didn't happen at all, but I was convinced that this is just a fact of life.
Really? You thought that was okay because that's what was written.
I had no reason to doubt it. It was in all the press and there were instances reported regularly and so on.
Yeah.
This shows you how wrong the conspiracy theory is.
Why? That to me shows me the conspiracy theory is just right there.
It was not only no conspiracy. Nobody directed it. Nobody wanted it. It just happened.
But it was focused on Black people smoking marijuana.
That's later. Not in my childhood. And by the way, I suppose it was true because Black people were poorer.
Yeah, so here we have essential disagreement because I say I think we don't see who directed it. It's not clear who directed it, but the direction.
But you assume that somebody directed it nonetheless.
Well, I see a direction. I see a vector.
Yes, you see a vector. So your theory is every time there is a vector, there is somebody behind it. This is Paley's theory for the existence of God.
That's wonderful. I don't know if that is that an easily refutable theory?
No, it's irrefutable.
Okay, which then makes it a bad theory.
Makes it a poor theory. It may be true. You don't know. You have nothing to say for or against it.
Okay. Well,
there are many such theories
that are irrefutable. Yeah, it's
that you don't have anything to say about them. The idea that there are habitable globes somewhere in the galaxy,
yeah,
which is today very topical. You have nothing to say for or against it. You can ask the question, is Mars habitable? That's a concrete question. You can investigate it.
Mm-hmm. Yeah.
Wittgenstein said, sorry.
Yeah, sorry. Wittgenstein's more better than what I was.
Wittgenstein said that questions that are undecidable are not questions.
That doesn't sound right.
I think he was an ass, yes.
Okay. We did some very, very good writing today. Thank you so much.
Most welcome.
I do think like looking at these, my vision is to take not form a complete narrative, but just snippets of the dialogue, edited, of course.
You do it as you think right.
Yes, and then I will show you and you tell me what you think.
Sure. גמרנו.
גמרנו, כן.